Everyone, this is Christos. Welcome to another day in my life, and today we're going to look at how to better manage Achilles pain. In clinic, many clients who first come to me have already worked at some kind of Achilles program with another provider, which may consist of a lot of strengthening exercises for the leg and stretching. But a lot of them still complain of Achilles discomfort. And I really think it's because there is not enough appreciation for the importance of good movement, specifically of the whole body, but also the heel and lower leg. So for a healthy Achilles, that is the tendon at the back. You've got the calf muscle tendon, and the tendon attaches to the top of the heel bone here. For a healthy one, it must be able to stretch and shorten. And it does this by stretching when the foot is flattening, actually stretching along the back here where it goes over the ankle joint. You'll see the ankle joint is opening there. But then actually shortening at the top of the heel bone as the heel bone tilts down, moving towards this leg bone. And then as the foot regains rigidity for a good push forwards in space, the leg bone here is going to be pulled backwards, which closes the joint, shortening the Achilles tendon there, and lengthening at the bottom. So you'll see there's actually kind of a lengthening, shortening relationship happening on the flattening and the lifting. Now, with people who continue to have Achilles pain, I see two issues. The first one is that the heel bone is unable to tilt down as the foot flattens. The tilting down would tug off the bottom of the Achilles because it will shorten as this point comes up towards the leg bone. So a lot of these heels will stay rigid as the person tries to get into the foot. And the second problem is that where the Achilles runs across the back of the ankle, it is stuck in this kind of lengthened position because the foot is stuck flat. See, the foot needs to be able to lift for there to be shortening at the back here. For many, they actually have both, so they're stuck with a flat foot with a heel bone that is tipped up, and this leg bone, because the foot is flat, is being pulled forward, really pulling length into the Achilles. So in this position where we've got kind of excess pull at the back, you could do as many calf strengthening exercises as you want, but it's not going to help the foot regain this rigid position where you have closure at the back, and it's not going to help the foot flatten with a good tilt down of the heel. Also, the stretching that has been done before might contribute to further problem because we're already kind of maximally stretched at the Achilles here at the back. So stretching into this area more is only going to provoke problems. So if you're someone with a heel that is stuck down, if you're someone with a heel that is stuck up and can't tilt down, we need to be able to get the heel to tilt down. So that's what I would be encouraging. Can the foot flatten with a heel bone that is tilting down? And then can the foot lift with the leg bone going back? That is a straightening of the knee to take excess pull out of the Achilles. So essentially the foot needs to be able to flatten well and lift if the Achilles is to be happy. And that won't come from strengthening or stretching. It's all about bone reorganization and encouraging bones to move into spaces they don't yet go, the heel bone to tilt down, the knee to straighten as the foot lifts. And if you can work on that and work with the body above it to enable these things to happen, that's where you'll see true long-lasting change. So I hope this helps, and if you've got any questions, just let me know. Thank you.